90% of HIV cases I diagnose walk into my urology office first. One of them was Henry, 33, healthy, athletic, and newly married. He came in complaining of pelvic pain and fatigue. No one, not even Henry, imagined what was really happening beneath the surface. I'm Dr. Jame, a urologist and HIV researcher with over 20 years of experience. I've seen hundreds of men like Henry, confident, busy, and unaware that HIV can hide behind ordinary urological symptoms. Today, I'll share 5 hidden warning signs that almost every man overlooks. These are signs your body quietly sends before it's too late to reverse the damage. Please listen carefully and watch until the end, because signs 4 and 5 could shape your future more than you realize. And I'll show you exactly how to recognize and act on them early. If you care about your health and your future, comment number 9 to remind yourself. Awareness always comes before protection. When Henry first walked into my clinic, he wasn't thinking about HIV. He thought it was just another prostate issue, something men his age occasionally face. His tests were normal, antibiotics didn't help, and yet the discomfort kept returning. Like many others, Henry had fallen into what I call the diagnostic blind spot. Most men never realize that early HIV can first show up through the urological system, in the form of pain, fatigue, or sexual changes. Studies show that over 70% of early-stage cases begin with these subtle, misleading signs, and because they look so ordinary, they're often treated symptom by symptom, never getting to the root cause. Henry's story is not rare. It's a mirror for millions of men who delay testing because everything seems normal. But ignoring these patterns can cost months, even years, of missed protection and declining health. That's why, in the next part, I'll walk you through the exact 5 symptoms Henry experienced, one by one, so you can recognize them early and act before it's too late. Because awareness isn't fear, it's the first form of strength. Symptom number 1: treatment-resistant chronic prostatitis. Henry's journey began with something that seemed ordinary: pelvic discomfort and a burning ache after intimacy. At first, he laughed it off, saying, "Maybe I've just been sitting too long at work." But the pain grew sharper, more persistent, until it followed him everywhere. Driving, exercising, even sleeping. When he came to see me, I ran the standard tests: urine cultures, prostate exams, imaging. Everything looked normal. We tried antibiotics, no change. We added anti-inflammatories, still nothing. For months, Henry moved from clinic to clinic, collecting prescriptions but not answers. Each doctor treated the symptom, not the pattern. As a urologist, I've seen this story too often. Chronic prostatitis that doesn't respond to treatment isn't just a stubborn infection. Sometimes it's a signal from a much deeper problem. In Henry's case, that hidden cause was quietly eroding his immune system. He told me, "Dr. Jame, I'm doing everything right, but my body feels wrong." That sentence stayed with me, because when a man listens to his body and still feels unheard, it's my job to look further than routine medicine. If you've ever had a problem that just won't heal, no matter how many pills or doctors you try, have you ever wondered what your body might really be trying to tell you? Let's move to the second warning sign, the one that began to change Henry's entire sense of confidence. Symptom number 2: unexplained erectile dysfunction in men under 40. When Henry returned a month later, his voice was quieter. "Dr. Jame," he said, "something's different. I can't stay firm like before." This was a man in his early 30s, healthy, active, confident, suddenly losing control of the one thing that made him feel alive and connected. Most men would blame stress or exhaustion. That's what Henry thought too. But what he didn't know was that HIV can silently interfere with the body's hormone system, especially testosterone. We ran every test imaginable: blood flow, heart, and vascular health. Everything looked perfect. And yet his testosterone was dropping fast. That was the first clue. When performance fades but circulation is fine, something deeper is wrong. Viagra didn't help. Therapy didn't help. What finally helped was understanding why. His immune system was under attack, disrupting the delicate balance that controls male performance. I told Henry gently, "This isn't about masculinity. It's biology, and biology never lies." He nodded, and for the first time I saw fear in his eyes, but also relief, because the truth meant he could act. If you've ever experienced sudden, unexplained changes in energy or performance, and everything seems normal on paper, your body might be whispering what the tests can't yet see. Have you ever faced something similar and brushed it off as stress? Let me know in the comments. Your honesty might help another man recognize his own silent warning. Now, let's move to the third sign, one that fooled every doctor before me, until we looked beyond the surface. Symptom number 3, recurrent UTI, like symptoms without bacteria. By the third visit, Henry looked exhausted. He told me, "It feels like a urinary infection that never ends." He had burning sensations, frequent trips to the bathroom, and cloudy urine. Every test result came back negative. No bacteria, no infection, no clear reason. Other doctors told him to drink more water or take another round of antibiotics. But deep down, Henry sensed something else. This was the moment patterns began to form. The symptoms came and went like waves. 2 good weeks, then another flare-up. That rhythm was my clue. In early HIV, the immune system begins to weaken just enough for the urinary tract to lose balance. You don't see full infection. You see confusion. The body trying, failing, trying again. I remember telling Henry, when lab results don't match how you feel, your body might be fighting something invisible. He looked at me and said, "So, it's not all in my head?" I smiled. "No, Henry, your body's been right all along. This pattern, recurring urinary symptoms without bacteria, is more common than most men realize, and too often it's dismissed as dehydration or stress. But sometimes it's your immune system asking for help long before things get serious." Have you ever had test results that said normal, yet you still felt something was wrong? Share your story in the comments and you might help another man see his own truth. Next, we'll uncover the fourth symptom, the one that finally made everything click for Henry, and changed how I approached every case after his. Symptom number 4, persistent groin, lymph node swelling. Few topics cause more confusion and anxiety among men than this one: lumps in the groin. Some ignore them in fear, others panic, assuming the worst. Henry was somewhere in between, quietly worried but too embarrassed to ask. He noticed a small, firm swelling near his groin that wouldn't go away. It wasn't painful, just there. He waited weeks thinking it was a sports injury, but after 2 months it was still the same. When he finally mentioned it, I could tell he'd been carrying silent fear. Here's the truth most people don't know. The groin lymph nodes are among the first places the immune system reacts when HIV enters the body. They're not random lumps, they're signals, immune cells working over time. Unlike typical infections that come and go, these nodes stay enlarged, firm, and mobile for weeks or even months. When I examined Henry, everything else looked fine. No fever, no major infection. That contrast was the key. His immune system was fighting something unseen. I told him, These lymph nodes aren't your enemy. They're your body's alarm." He sighed. "So it's been trying to tell me all along. If you've ever felt a lump and convinced yourself it's nothing, would you still wait if your body's been ringing the same alarm for months?" Tell me your honest thoughts in the comments. In the next part, we'll reach the fifth and final symptom, the one most men overlook because it feels too ordinary. Yet, it's the biggest turning point in Henry's story. Symptom Digger 5, night sweats and urological changes. There's one symptom that almost every man ignores: night sweats. You wake up drenched, sheets soaked, thinking it's the weather, stress, or maybe that extra glass of wine. That's exactly what Henry thought too. But when night after night he woke up sweating and felt new changes in urination, more frequency, cloudy urine, and mild groin ache, something didn't add up. What makes this combination dangerous is how ordinary it seems. Most doctors separate the two. Maybe it's hormones, or maybe it's an infection. But when night sweats and urological issues appear together, it's often a sign of a systemic infection, one that's quietly affecting the immune system from the inside out. Henry's turning point came when he told me, "I'm sweating through my clothes, but I'm not sick." That's when I knew it was time for a full immune panel, including an HIV test. The results confirmed what his body had been signaling for months: early-stage HIV, fully treatable because we caught it in time. I still remember his face when he heard the truth. Fear first, then relief. Because truth brings power, and the chance to act before damage is done. So, if you've been waking up drenched or feeling subtle changes down there, don't ignore them. Have you ever noticed these two symptoms together? Comment below. Your words could help another man wake up to reality. Congratulations! You've just learned what 90% of men haven't realized in the last 10 years. And now, the remaining 30%, the life-saving knowledge that can keep you healthy for decades, starts right here with me. Let's begin. Why 90% get missed? When I first told Henry his results, he went completely silent. He wasn't angry. He was confused. "How could this happen?" he whispered. "I've been to 3 doctors. Not one mentioned HIV." That silence captures what I call the 90% gap, the space where awareness fails long before medicine begins. Most men, like Henry, don't fit the stereotype of someone living with HIV. They're professionals, husbands, fathers, healthy on the outside, unaware of what's hiding within. The virus is subtle, and its early signs perfectly mimic common urological problems. Doctors treat infections, inflammation, or hormones, never realizing the deeper cause. It's not neglect, it's how medicine is trained to think, common things first. But HIV doesn't play by common rules. Then there's stigma. Some doctors still hesitate to suggest an HIV test unless patients mention risky behavior. Many men, out of pride or fear, avoid discussing their sexual history. Henry told me, "I didn't think I needed that test. I'm married." But biology doesn't follow labels. It follows exposure and opportunity. That's why the virus finds silence so useful. Shame keeps people quiet, and quiet keeps it hidden. Henry's case changed how I practiced medicine. I realized awareness is not just science, it's empathy. The moment we remove judgment, we open the door for healing. When I looked at Henry's eyes that day, I said, "You didn't fail yourself, Henry. The system did. Now we take back control." He nodded, and I saw determination replace fear. So, let me ask you this. Have you ever avoided a test because you feared the answer? Comment below, because facing that fear is exactly where healing begins. In the next part, we'll explore Henry's turning point. the synergy between truth, courage, and recovery. This is where awareness becomes strength and fear transforms into power. The day Henry received his diagnosis, everything slowed down. I still remember him staring at the floor, hands trembling. He wasn't afraid of dying, he was afraid of what people might think. That's the quiet pain most men never talk about. But instead of collapsing under the weight of fear, Henry did something powerful. He faced it. We spent that afternoon talking, not just about medicine, but about meaning. I told him about you, DXE, you. Undetectable equals untransmittable. Once treated, the virus becomes so suppressed that it can't be passed to anyone else. Henry leaned back, processing every word. Then he said softly, "So I can live normally and protect the people I love?" "Yes," I said. "That's exactly what this means." From that moment, something changed in him. He stopped seeing HIV as a death sentence and started seeing it as a wake-up call, a chance to rebuild. He followed every instruction, came to every follow-up, and turned discipline into his strength. Within months, his lab results improved, his energy returned, and his confidence came back. But what stood out most was how he began helping others. Henry started volunteering at awareness workshops, telling his story to young men who believed, just as he once did, that it could never happen to them. His honesty became medicine for others. He told me later, "Dr. Jame, I used to be ashamed. Now I'm grateful, because knowing the truth saved my life." That's the synergy I talk about. The point where knowledge meets courage and fear transforms into clarity. Have you ever turned a painful moment into something that gave you strength? Comment below. You might inspire someone who's still standing where Henry once stood. Next, I'll share the 5 mistakes Henry made before his diagnosis, and how you can avoid every single one of them. Common mistakes. The silent traps that nearly cost Henry everything. Before Henry's recovery, there was a time when every choice he made unknowingly pushed him closer to danger. These aren't rare mistakes. They're the same ones I see in men across America every single week. And the truth is harsh. These mistakes don't just delay diagnosis. They can destroy lives. Mistake number 1. Ignoring persistent symptoms. Henry spent nearly a year brushing off pain and fatigue as stress. Each delay allowed the virus to grow stronger. The lesson: when something feels off for too long, it's not anxiety, it's information. Mistake number 2. Self-medicating. He tried herbal pills and internet advice before ever asking a specialist. Quick fixes gave comfort, but never healing. Online solutions can't replace a real diagnosis. Mistake number 3. Avoiding tests out of fear. Henry once told me, "I didn't want to know." That sentence has ended more lives than the disease itself. Fear of testing is the most dangerous symptom of all. Mistake number 4. Assuming it's just age. He was only 33 but already believed his body was slowing down. This mindset convinces too many men that decline is normal when it's actually preventable. Mistake number 5. Stopping follow-ups too soon. After temporary relief, Henry skipped appointments. That small gap could have cost him early treatment. Consistency saves more lives than medicine alone. When Henry finally faced these mistakes, he changed one thing. He stopped waiting. Within weeks of his diagnosis, treatment began, and his numbers improved. Courage replaced hesitation. If you recognize even one of these patterns in your own life, you're not alone. Comment 1 to 5 below and tell me which mistake you've learned from, because speaking it aloud is the first step toward control. In the next section, I'll reveal the exact routine Henry used to rebuild his health, 3 steps that any man can follow starting today to reclaim his energy, confidence, and peace of mind. The 3 steps that saved Henry's life. By the time Henry began treatment, he had one mission: to take back control of his life. He wasn't just fighting a virus, he was reclaiming his future. And what worked for him wasn't luck. It was a clear, structured plan that any man watching right now can follow. I call it the C-Sense Strengthen Routine. Step 1. C. Pay attention to what your body is trying to show you. Henry started tracking every symptom: energy dips, sleep patterns, mood changes, even subtle shifts in urination. Within 2 weeks, he saw a pattern. What you notice early, you can change early. Step 2. Sense. Don't ignore your intuition. Henry told me, something inside me knew this wasn't normal. Listen to that voice. If your body feels wrong even when the tests look fine, ask for a deeper check. Request an HIV test, hormone panel, or immune screening. You deserve clarity, not assumptions. Step 3. Strengthen. Healing isn't just medication. It's rebuilding everything that keeps you alive: nutrition, rest, mindset, and purpose. Henry exercised lightly, ate clean, stayed consistent with treatment, and practiced gratitude daily. Within 6 months, his viral load was undetectable. Now he mentors others. Proof that early action can turn fear into freedom. If you've been waiting for a sign to start your own recovery, this is it. Comment 7. If you're ready to begin today, because the strongest men aren't those who never fall. They're the ones who rise with awareness. In our final part, I'll bring everything together: Henry's lessons, the 5 hidden signs, and the truth every man should carry for life. And now, I just want to remind you briefly of the essential things to remember and do from this message. Your health is the greatest honor of my profession. Henry's story isn't just about illness. It's about awakening. He walked in thinking he had a minor prostate issue and walked out understanding that his body had been speaking to him all along. That's what I want every man watching to realize. Your body never lies. It only whispers until it has to scream. We've talked about the 5 hidden symptoms that 90% of men miss: the pain that won't go away, the unexplained performance drop, the fake urinary infections, the quiet swelling in your groin, and the night sweats that seem harmless but mean much more. Each one is a warning light, not a death sentence. Henry proved that truth doesn't destroy, it heals. Once he faced his diagnosis, he gained time, clarity, and peace. Today, his tests are perfect, his energy is back, and his story has saved countless others who once stood where you stand right now. So, what can you take from this? Don't wait for symptoms to become suffering. Don't trade silence for safety. Awareness isn't fear, it's freedom. If this story opened your eyes, comment number 9 below. That number means moving forward. A promise to yourself that you choose action over avoidance, health over hesitation. And if you're new here, subscribe to Health First Hub. Together, we'll keep breaking stigma, learning truth, and protecting the men who matter most, including you. Now, before we close, let me say this clearly. You've already taken the most powerful step. You stayed, you listened, you learned. And now, I just want to emphasize the key things to remember and do from this video. Listen to your body. Get tested early. Protect your future, because your health is the greatest honor of my profession.